Alright. This patient has been difficult to deal with, like always. Alright, scene safe, PPE, MOI, NOI, number of patients is 1. Additional resources will call for fire, PD, and ALS. C-spine, I'm going to defer. General impression, I see a 60-year-old female just sitting on her couch in her living room. And then life threats, there's none. And then AFPU, I'll just, hi ma'am, she was alert. So she does not appear confused, just appears normal baseline, as far as I know. What seems to be going on today? She says her glucose is low. Alright, when did you last check it? She says about 30 minutes ago, and it was at around 50. Alright, do you take insulin? She says yes. She took it this morning like always. Alright, and did you eat today? She says no, she forgot to eat, so that could be why. I'm going to do a quick assessment. So I'll do airway, is it open, is it clear? I'll do rate, rhythm, and quality of breathing. It would all be normal. I'm going to auscultate. All be normal. And then at this point, I would defer oxygen because there's no breathing abnormalities. I'm going to do circulation really quick. So rate, rhythm, and quality, TTC, and cap refill, all normal. And I'm going to defer a blood sweep because she's sitting at home. I'm going to say non-priority because she's not, her consciousness isn't, or altered mental state, she's normal. She has no loss of consciousness. No other signs, physical signs that I can see right now. And then before I do sample, I'm going to go ahead and get vitals because her blood sugar was low. So I'll do blood pressure, respiratory rate, heart rate, BGL, and SpO2. When I check the BGL, it is reading at 52, so that is hypoglycemic. And because this patient is able to talk, she's able to control her own airway, able to follow commands, I can go ahead and administer oral glucose in the tube. It's 15 grams. Alright, ma'am, I'm going to hand you this tube of glucose. I'm just going to have you eat that whole thing, okay? Just do it slowly. She does it, and then I'm going to recheck her glucose in 5 minutes. So in the meantime, I'm just going to go through sample and OPQRST. So, alright, what symptoms are you having right now? She says just a little dizziness, nothing else. Do you have any allergies? She says no. Any medications that you take besides the insulin? No. And you are a type 2 diabetic? She says yes. Alright, you said you haven't eaten today, correct? Okay, what were you doing before this happened? She says she was just sitting on her couch, nothing specific. Alright, so you said, when did this start? Alright, she says it happened about 45 minutes ago. She checked her glucose about 30 minutes ago. So she checked her glucose 15 minutes after she started feeling dizzy. Does anything make it worse or better? Not that she knows of. Okay. Quality, can't really describe it because, I guess I could. What does the dizziness feel like? She just feels like she's drunk, not like the room is spinning. Alright. And what would you rate that dizziness on a scale from 1 to 10? She says like a 3. Alright. And then timing we already know, so I'm going to recheck that blood glucose, and it came up to, let's say, 84. So she's good, and then I would transport her to the hospital, non-priority.